We will start the lecture. Huh? Today we are taking routes of administration. Huh? What are the routes? Drugs are given by oral route, parenteral route, huh? Topical application. Now we will see the routes of administration. Huh? Now drugs are given administered by various routes. The choice of route in the patient depends on properties of the drug and the patient's requirement. All the routes have these routes have some advantages and some disadvantages. What we are taking routes of administration. Yeah? Drugs are given by different routes. We are giving drugs कैसे देते हैं? We are giving drugs orally. We are giving drugs orally by injections, huh? and topical application. Now we will see the classification of drugs. Are you hearing, listening now? Say yes.
Yes, ma'am.
हाँ.
Yes, ma'am.
हाँ, ठीक है. We are seeing classification of drugs. So routes of administration. The drugs are given by different routes. And now in classification, there are local and systemic. How this is classified? Local and systemic. Huh? In systemic, local route में क्या होता है? Local route. The drugs are applied topically to skin and mucous membrane. Huh? Listen. Remember, local में क्या करते हैं अपन? Ointments वो locally लगाते हैं skin पे. That is the local route. Drugs are applied topically to skin and mucous membrane for their local action. These drugs have local action. No, not systemic action is very less. Huh? These local drugs have local action. They are applied to the skin. For this, how local route, oral cavity. Huh? Oral cavity we use sprays, creams are used. Oral cavity, these sprays, creams are used. Nystatin patch for clotrimazole oral candidiasis. Clotrimazole is used for candidiasis. This means for oral cavity, this local route, these sprays, creams are used. For GI tract, neomycin used for sterilization of gut before surgery. While doing surgery, this neomycin is used for sterilization of gut before surgery. This is local route. Then in local route, enemas are there. Enemas where they are given rectum. You are knowing rectum. These enemas are used. Enemas are of two types: evacuant enema and retention enema. In evacuant enema, soap water is used, and in retention enema, methyl prednisolone is used for ulcerative colitis. The drugs are passed in rectum. They left there. Then evacuation of rectum is done. When drugs suppository, what is suppository? When the tablet is kept at the rectum, that is suppository. That is bisacodyl suppository. Now for ear, nose and eye, we use drops, ointments, sprays. For example of this is gentamicin eye drop, gentamicin ear drop. These are locally applied. Means for bronchi, inhalation, salbutamol, ipratropium bromide in chronic obstructive pulmonary disease. These drugs are used and they are given by inhalation. Vagina, cream, pessary. When drugs are used for vagina, for rectum, they are called as suppository. And when they are used for vagina, They are called as pessary. For vagina, creams, pessary are used. For urethra, jellies are used. Lignocaine jelly. For skin, skin locally we apply ointment, cream, powders. These are applied locally to the skin. You are knowing. Example of this is clotrimazole antifungal for candidiasis. Now the intra-arterial route drugs are given in arteries. It is used for diagnostic purpose, coronary angiography. In local, what comes? Intra-arterial route. Anti-cancer drugs for treatment of malignancy involving legs. This is about local route. Huh? We have seen drugs are given by different routes and their classification. In classification, we have seen local drugs are applied locally and systemically. Local application applied to skin, oral cavity, ear, nose, oral cavity. These are seen in local. Drugs are applied locally and they have local action. Systemic action is less. Systemic action is what? When they goes in blood, that is systemic action. After local route, we will see systemic classification of route of administration. Systemic route of classification is further classified into oral and parenteral, enteral and parenteral. In enteral, there is oral, sublingual and rectal route. And in parenteral, there is injections, inhalations and transdermal patches. Now, we will see the oral route. I have told you in the beginning what these routes have some advantages and disadvantages, and these advantages and disadvantages are asked in examination. We have seen local classification in systemic, enteral and parenteral. In enteral, we will see the oral route. In oral route, the drugs are given orally. How? Orally. What we take orally? Tablet, syrup. This is oral route. What are the advantages of this route? This is asked in exam. Short questions are asked. What are the advantages? This is self-administration is possible. This route is economic, safe and convenient. Self-administration, economic, safe and convenient. These are advantages of this oral route. What? These have some advantages. These are the advantages. We can take self. This is the advantage. Now disadvantage is what? Irritant and unpleasant drugs are not given. We can't give irritant and unpleasant drugs by oral route. Nausea and vomiting, this route is not used. In nausea and vomiting, we can't use the oral route. This is the disadvantage. Gastric irritation causes by some tablets. This is the disadvantage. What are the, I have told you, oral routes, advantages and disadvantages. Now we will see this sublingual route. What is sublingual route? The palate is kept below the tongue and absorption occurs through buccal mucosa. Below the tongue, this tablet is kept and the tablet delivers drug from there and absorption occurs through buccal mucosa in the systemic circulation and systemic action occurs. What are the advantages of this route? Action is rapid. What? Action is rapid. First pass metabolism is avoided. You remember like this way. Action is rapid. First pass metabolism is avoided. We can spit out tablet after desired effect. What are the advantages? We have seen oral route. After oral route, there is sublingual route. Palate means tablet is kept below the tongue. Action is rapid. First pass metabolism avoided. We can spit out tablet after desired effect. Spit out means we can remove the tablets after its desired effect. Disadvantage, irritation of buccal mucosa. Huh? What is the disadvantage of sublingual route? Irritation of buccal mucosa. Example of this is nitroglycerol trinitrate. This is used in myocardial infarction, angina. Now rectal route we have seen evacuation and retention enema. This is about oral route, sublingual route and rectal route. In enteral, oral, sublingual and rectal comes. You have seen what is the oral route, given how the tablets are given, what are the advantages and what are the disadvantages. Then sublingual route, how the tablet is, where is the tablet is kept. Then the rectal route. Now we will see the parenteral route. In parenteral route, what comes? Injections. Drugs are given by injections. Inhalation, by inhalation drugs are given, and transdermal patches. What are the injections? Injections are given by intradermal route, means they are given in skin. Subcutaneous injections are intradermal. Subcutaneous, intradermal means the injections are given in skin, and example is BCG vaccine. You have to give example of each and every route. In exam, if it is asked to write parenteral route, then you have to write intradermal route. You have to give injections in the skin. Example is BCG vaccine. Then subcutaneous. In parenteral, what comes? Intradermal, subcutaneous. Subcutaneous means below the skin. Injections are given subcutaneously. In diabetes, the injections with that insulin pen is there. Insulin is given subcutaneously. Example of subcutaneous route is insulin. It is given subcutaneously. Intradermal route, then subcutaneous route. Then intramuscular route. Intramuscular route, injections are given intramuscularly. In the muscle, injections are given in the muscle. That is the intramuscular route. What a intravenous route? In intravenous route, the injections are given in the vein. That is the intravenous route. What we have seen? Injections. Parenteral route, injections. Injections are given in the skin. That is intradermal route. In the subcutaneous, that is subcutaneous route. Intramuscular, that is a muscle. In the muscle, intramuscular route. And intravenous, the veins, in the veins. These have some advantages and disadvantages. If we are giving injections, they are painful. That is the disadvantage. And what is the advantage? Action is rapid. That is the advantage. And intravenous route, there may be chances of thrombophlebitis. This is the disadvantage of this intravenous route. Then we will see inhalation. This salbutamol is given by inhalation in bronchial asthma. This is the example of this inhalation route. You have to give example. Now intradermal route. In intradermal route, what? The injection intradermal the intradermal patches are applied. Intradermal route, intradermal patches are applied. This uh, hyoscine patch is applied behind the ear in motion sickness, that is transdermal route. These patches deliver the drug constantly. Patches, and the advantage is what? It is convenient. Then disadvantage is that it may fall out, the strip may fall out unknown, ऐसे fall होऊ शकते. This is the classification of route of administration. What is local and systemic? In systemic, enteral and parenteral. In enteral, oral, sublingual and rectal. In parenteral, injections, inhalation and transdermal route. We have seen what is local route of administration. हाँ? लोकल में क्या कैसा अप्लाई करते, स्किन एंड म्यूकस मेम्ब्रेन पे अप्लाई करते, लोशन वो लगाते ना, ऑइंटमेंट्स, sprays, powders. This is local route. Then we have seen oral, sublingual. If sublingual route is asked, then the palate is applied below the tongue. Then we have seen parenteral route. In this, injections, inhalation and transdermal. Then you have dosage forms. In dosage forms, you have to remember dosage form means what? Drugs are given in these forms. Means, kaise, what is dosage form? In which form the drug is given. Agar tablet dosage forms are solids and liquids. In solid dosage form, what comes? Tablets, powders, capsules. Means we are giving the drug in that form. अगर हम टैबलेट फॉर्म में देते हैं, that is solid dosage form. Powder, if we are giving suspension, solution, this is liquid dosage form. You have to remember dosage forms also. What is dosage form means? Drugs are given in these forms. What is dosage forms? In drugs are given in that form, means tablet form, liquid form. This is dosage form. The dosage form में क्या याद रखना है? What are the dosage form? Dosage forms are solids and liquids. In solids, tablet, powder, capsules are solid dosage forms, and suspension, elixir, these are liquid dosage forms. This is about routes of administration and dosage forms. तो ड्रग्स कैसे देते हैं हम? ओरली देते हैं, हाँ, टॉपिकली अप्लाई करते हैं, उसके बाद पैरेंटरली बोलते हैं, मीन्स इंजेक्शन से देते हैं, बाय इनहेलेशन से देते हैं हम ड्रग्स. बैंडेज स्ट्रिप्स आर अप्लाइड, हायोसिन स्ट्रिप, लाइक दैट दे आर. In this way, the drugs are given. और we have seen, हमने और क्या देखा है? डोसेज फॉर्म्स. डोसेज फॉर्म कौन से फॉर्म में ड्रग देते हैं हम? टैबलेट देते हैं, दैट इज सॉलिड डोसेज फॉर्म. हम लिक्विड देते हैं, सस्पेंशन, सोल्यूशन रहता है ना ड्रग्स में, तो दैट इज लिक्विड डोसेज फॉर्म. दिस इज all about routes of administration. You should read. The question is asked on route of administration. पूरा पूछ सकते हैं, नहीं तो छोटे छोटे क्वेश्चंस भी आते हैं. What is topical route of administration? What is sublingual route of administration? What is oral route of administration? What is parenteral route? ऐसे छोटे छोटे क्वेश्चन, शॉर्ट क्वेश्चन में भी पूछ सकते हैं. तो उसके एडवांटेजेस और डिसएडवांटेजेस बोलने आना चाहिए, लिखने आना चाहिए. क्या है? सब ड्रग्स को फ्यू एडवांटेजेस है और कुछ डिसएडवांटेजेस है. You should remember that. Advantages and disadvantages.
Ma'am,
Ah,
will you please repeat the advantages and disadvantages of intradermal and intramuscular injections?
I will repeat. Intradermal and intramuscular. Okay? Okay, okay.
Yes, ma'am.
Okay, okay.
Thank you.
अगर इंट्राडर्मली इंजेक्शन दिया है, हाँ, एडवांटेजेस क्या है? पेन, इट हैज पेन, पेन होता है, दैट इज द डिसएडवांटेज. बट व्हाट आर द एडवांटेजेस? द एब्जॉर्प्शन इज रैपिड, हाँ, फर्स्ट पास मेटाबॉलिज्म इज अवॉइडेड. दिस इज द एडवांटेजेस ऑफ इंट्रामस्कुलर रूट. और क्या इंट्रामस्कुलर? और हेलो,
Intravenous and intramuscular.
इंट्रामस्कुलर का समझाए क्या है? इंट्रामस्कुलर देने से क्या होता है? पेन, दैट इज द डिसएडवांटेज. हाँ, और एडवांटेज क्या है? एब्सॉर्प्शन रैपिड होता है, एब्सॉर्प्शन रैपिड होता है और फर्स्ट पास मेटाबॉलिज्म अवॉइड होता है. दैट इज द एडवांटेज ऑफ इंट्रामस्कुलर. और इंट्रावेनस का क्या है? इंट्रावेनसली इफ यू आर गिविंग, एब्सॉर्प्शन इज 100% विथ इंट्रावेनस एब्सॉर्प्शन. क्या होता है? इंट्रावेनस देने से पूरा टोटल ड्रग सिस्टमिक सर्कुलेशन में जाता है और इट हैज 100% बायो अवेलेबिलिटी. एंड what is the disadvantage? When we are giving the injection in vein, thrombophlebitis may occur. Thrombophlebitis means infection, the blood clot hota hai, that is thrombophlebitis. This is the disadvantage of intravenous route. Advantage क्या है? 100% bioavailability and first pass metabolism is avoided. 100% bioavailability, ये it is important advantage of this intravenous route. And what is disadvantage? Thrombophlebitis occurs, infection. We have to take aseptic precautions while giving intravenous injections. This is uh, disadvantage of this intravenous route. Understood? समझा है क्या? इंट्रामस्कुलर समझा क्या? हेलो,
Yes, ma'am.
हाँ,
Yes,
इंट्रावेनस का समझा है क्या? समझा होगा अभी.
yes, ma'am.
हाँ,
Understood.
हाँ, okay, okay. Okay. This is all about routes of administration. Huh?
Ma'am,
Uh,
ointments will come under the liquid dosage form. Ointments or creams.
liquid dosage form what?
Ointments or creams which we use in local, then they will come in which dosage form? Liquid dosage form will be there.
ऑइनमेंट ना, वो उतना डीप में जाने की जरूरत नहीं. ऑइनमेंट है तो टॉपिकल डोसेज फॉर्म में आता है, वो तुमको नहीं है वो डिटेल, उतना डिटेल में नहीं जाने का.
Okay.
हाँ, that is topical dosage form. Ointment or cream जो है ना, that is topical dosage form. You have only सॉलिड एंड लिक्विड याद रखो तुम, सॉलिड क्या है और लिक्विड क्या है. हाँ, और अगर क्यूरियसिटी है, जानना है तो ठीक है, दैट इज टॉपिकल डोसेज फॉर्म. We will apply that on the skin only, and that has local action. समझा?
Yes, ma'am. Understood.
हाँ. Now this is all about rules of administration.